340B drug pricing has been an important program to meet the needs of underserved patient populations and the hospitals that serve them, at no cost to taxpayers. It is complicated, but let's see if I can explain the basics. How did it get started? Way back in 1992, Congress passed the program and President Bush signed it into law as Section 340B of the Public Health Service Act, hence its name. The Act requires pharmaceutical companies to provide discounts on outpatient drugs to providers serving a large number of uninsured and underinsured patients. When Congress created 340B, they stated that the program's purpose was to enable covered entities to stretch scarce federal resources as far as possible, reaching more eligible patients and providing more comprehensive services. So, who are these covered entities? When the program began, safety net hospitals, some of which are teaching hospitals, along with their outpatient clinics, as well as community health centers, were the primary participants. Due to the program's success in helping patients, Congress expanded it to include children's hospitals, outpatient cancer center hospitals, and many rural providers, including Medicare-designated critical access hospitals, rural referral centers, and sole community hospitals. How does the program work? Pharmaceutical companies, as a condition for participating in Medicaid, provide discounts on outpatient drugs directly to the covered entities. So what are hospitals doing with the savings from the program discounts? Some hospitals use the savings to provide drugs for free or at substantially discounted prices to uninsured and low-income patients. But the importance of the savings is part of a bigger story. Discounted drugs are just one part of the safety net designed to improve the health of underserved populations. Hospitals also use the savings to support other services and may include prevention-focused primary care clinics, multidisciplinary substance use disorder and mental health services, home infusion and nursing services, and even transportation and housing support. How much does the program cost taxpayers? The answer is nothing, other than the very modest cost of running the program. That's right, Uncle Sam does not fund the program. These are discounts provided by pharmaceutical companies directly to their providers. So, how much does the program cost pharmaceutical companies? Total 340B sales represent less than 3% of the $457 billion in U.S. drug sales, even less if you count their global business. This percentage has remained steady, and pharmaceutical companies have been able to maintain profit margins between 15 to 20%, even as the program has grown. So why is 340B now getting so much attention? Pharmaceutical companies have argued that the number of covered entities should be constrained, but limiting the number of entities would reduce the number of patients and communities served. Given that the program is a small fraction of pharmaceutical sales and costs taxpayers nothing, the discounts are a critical and affordable source of support for holding together the building blocks of the healthcare safety net for vulnerable patients. Without them, other components to the safety net would be put at risk, and in some communities, the ability for the hospital or clinic to survive could be called into question. Hopefully, you now have a better understanding of this important program and how it has become an integral part of the healthcare safety net. Any effort to change the program should strengthen, not undermine it, so that the 340B program can continue to provide the vital support to safety net hospitals and other healthcare providers as they work to serve patients in their communities.